WBTV News starts right now.
Next at 6:30, a military life can cause a huge strain on the back and the entire body for that matter. This morning, a local chiropractic is here to talk about just that. We'll be back after this. Welcome back, everyone. Every day, our servicemen and women put their lives on the line for our freedom, but that can come with a cost. Back pain is a common problem. This morning, we have Dr. Featherstone here from The Joint to talk about relief. So, doctor, how big of an issue is this? I've never been in the military, but you said, they're carrying gear and doing all these different things. You've been doing this a long time. Talk about how big of an issue this is.
It's become a world, obviously, wide with all of the stresses, not only the mechanical stresses of carrying 50, 60, 70 pounds of gear, body armor, weapons, but stress, stress alone. Pilots, whether you're in the infantry or you're a intelligence individual or clerical, it doesn't matter. All of those stresses and all of those activities contribute to different kinds of pain, whether it's neck pain or it's low back pain, legs, arms, back, headaches. All of those are contributory.
And you were citing a report here that said 44% of the U.S. military have some sort of probably back pain. So can you walk us through kind of what happens, or how you guys work on fixing that?
Exactly. So if you look at the spine's three main curves. There's two developmental curves, one in the neck here and one in the low back, and then the main curve, the thoracic spine, that lends support to the low back and the neck and shoulders. So any sort of additional pressure on this part of the spine changes how the spine supports, and if that happens, then these joints begin to move poorly. And as you know, the spinal cord's inside here, and it is the way the brain talks to body, body talks to brain. So if there is any sort of change in how these vertebrae move, then this nerve trunk and all of the nerve trunks begin to lose their ability to help the body do what it does naturally, which is to heal itself.
Okay, so let's talk about The Joint. What do you guys do? Obviously, you guys care about the military, and so you guys are actually offering appointments. You don't even make an appointment.
No appointments. That's the wonderful convenience about The Joint. 350 presently throughout the United States. If you are a member at a Joint here in Charlotte and you go to Dallas, Texas, you can go right in. The doctors there can see what your chart is like, and they can treat you right there. Our military appreciation program is significantly discounted, so that in our thank you to the military, so they can come in. Your first visit is a consultation, examination by the doctor, and your first treatment, and it's a $19 fee.
Okay. For military?
For military. And then it's a $29 fee for folks just like you and me.
Right.
No appointments are ever necessary. Follow-up visits, usually that initial visit is maybe a 20-25 minute opportunity with the doctor and to get examined and treated. And then follow-up visits 3 to 5 minutes. So you can come in, as I said again, no appointments, so it allows convenience and it allows affordability.
So one quick question. Where are you guys located? For some military member maybe watching this and saying, golly,
we have throughout Mecklenburg County, we have 5 locations: Huntersville and Birkdale Village, Stonecrest, Arboretum, Mallard Creek, and one additional clinic in the Fort Mill area. So we are about the entire Charlotte area.
All right, perfect. All right, so we're going to have this whole segment and a lot more information about this on WBTV.com. If you are a military member or even just a normal person struggling with back pain, this may be a great solution for you. Thank you so much
for joining us.
Thank you. And we will be back right after this.